Hello everyone. Hello everyone, and welcome to this audio podcast today. This audio podcast is part of the Cytometry Cyclone. This audio podcast is part of the Rakas and Bombard episode, and this audio podcast is part of a Storm Robotics production. Today, and in following and looking at this episode, looking at part of this audio podcast episode. In regard to debunking challenges and mentoring healthcare service users and healthcare service providers or healthcare professionals. In and around this theme, in around this now looking at in around this theme, decolonizing and diversifying through social media. So managing and providing a sort of educational support in context of healthcare and in context of healthcare to healthcare service users and healthcare service providers in around long-standing conditions, for example, has been in the hands of healthcare service providers mainly and through this audio podcast series. The long-standing condition had been in and around chronic kidney disease, or CKD. In the hands of healthcare service providers, in context of nephrologists or kidney specialists and specialist nurses. Healthcare service users, healthcare service users, are not always aware of diagnosis or armed with informational context, owing to how symptomologies and disease or conditions become quickly multifaceted. However, since CKD, chronic kidney disease, is irreversible, is irreversible, and therefore, it is where healthcare service users and patients need to be aware, or should be aware of the condition, in around specific disease aspects and symptomologies, and in around their trajectory. And in the case of pediatrics and or young people, though, and for example, it is also important to involve carers, parents and guardians, so that they are equipped to provide, so they are so that they are equipped with best practices. At the same time, decolonizing immunology or immunobiology immunobiology investigation. It is now where sort of two social media platforms, the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, KDARS group, for kids, have been have been have been have been have been supporting healthcare service users and healthcare providers in around in around this around the different aspects of different aspects of laboratory investigations, but also in around aspects of kidney or kidney or renal conditions and symptomologies more generally. So the following the following was in the following and the two subsequent audio podcasts as part of this audio podcast episode, there will be an overview in regard to some of the works or backdrop, if you like, in regard to the RPSG and CADARs. So that draws this audio podcast to a close. This audio podcast as part of a Cytometry Cyclone. This audio podcast as part of a Rakas and Bombard episode. And this audio podcast as part of a Storm Logistics production.